On this edition of The Fifth Estate.
I was a victim of fraud in 2022.
I had my identity stolen in 2021.
I realized my identity was stolen in early 2023.
We're in the interior of British Columbia, where a massive security breach has upended the lives of thousands of healthcare workers.
I said, "Oh, have I been called for jury duty?" And he said, "No, actually, these are criminal charges."
We investigate the breach.
Did you believe that the source of the information breach was your employer, Interior Health?
100%.
And a decade of denials from a BC government agency.
What kind of gong show is this government running in Interior Health?
Your role is to step in and investigate. I can't believe they just denied it.
And we'll take you inside criminal networks using the dark web to steal identities and steal from you, the Canadian taxpayer.
Just want to ask you questions about the identity theft. I just want to find out how you got those names that you could use with the stolen identity.
I'm Mark Kelley. This is The Fifth Estate. This is British Columbia's rugged interior. A massive data breach has brought us here, leaving a trail of victims of fraud and identity theft. This could happen to you, and if it does, you may never even know. That's exactly what's happened to a nurse here in the town of Fernie. We've come to meet her.
Leslie.
Hi.
I'm Mark Kelley.
Hi, good to meet you.
Nice to meet you. Can I come in? Thank you.
Her name is Leslie Warner.
Start at the beginning. What is this?
This is the fraud file.
Her odyssey began in 2021 when she discovered someone stole her personal information, her social insurance number, her date of birth, her home address, and then hacked into her Canada Revenue Agency account to file a bogus tax return in her name.
I logged into my CRA account and I noticed notice of assessments for returns I had not filed. My address had changed, my bank account had changed, and I just kept saying, "Oh my God, this is bad." At one point, it was like between CERB benefits, false tax returns, and the Alberta social services stuff, I guesstimate like probably around 30 grand, I would say, was taken under my name.
They stole
in
with
one
your
way or
name.
another. Yeah.
They stole from the Canadian taxpayer, but
before
in your name.
Anybody stopped anything. Yeah.
Earlier this year, a Fifth Estate investigation revealed multiple cases of imposters hacking into people's CRA accounts, filing bogus tax returns, and defrauding Canadian taxpayers.
I'm about a month and a half away from losing my house.
What we didn't know then was how the criminals were getting people's private information and how so many were getting away with it. Then we got a tantalizing tip, an email from someone who claimed they knew this breach was bigger than we ever imagined, with tens of thousands of potential victims.
Dear CBC Fifth Estate team, as an ex-criminal who was involved in similar activities in the past, I now want to help others and right my wrongs. I wish to remain anonymous, but I believe the details I have could be crucial to your investigation.
That investigation revealed the CRA was duped by an imposter using the name and social insurance number of a BC woman named Heidi Gurman to get their fake tax refund. So last year, we found the real Heidi Gurman tending bar at Jimmy's Pub in the town of Creston.
Then we have also from Stanley Park, which is from Vancouver, the Amber Ale.
She had no idea who her imposter was, but she did know the CRA was now demanding that she pay back the money stolen in her name.
What do you want to know? Do you want to know who's responsible for this?
Yeah, I would love to know who's responsible because I'd actually really love to know how to get my identity back. how to get my identity back.
This was an opening for Anonymous to prove how Gurman's identity was stolen and that they were an ally in our investigation.
I've attached one of the identities as proof that this tip is legitimate and not a false claim. Sincerely, Anonymous.
And there it was. Heidi Gurman's personal information, her social insurance number, her middle name, her phone number, her date of birth, her home address. And it seemed they had plenty more information to share.
Please feel free to contact me back at this email address.
This Kelowna nurse knew nothing about Anonymous, but we'd soon learn Anonymous had a connection to her.
My name is Ashley Stone. I've been employed as a registered nurse since 2009 at Interior Health, and I first discovered my identity was stolen in 2014.
Interior Health is proud to be one of the top 100 places to work in Canada.
The BC Health Authority boasted it was named one of Canada's top employers for 2025 on its YouTube site. With 29,000 employees, IH, as it's known, is one of the biggest employers in the region.
Everyone is committed to making this an organization where people want to join, grow, and stay. We are Interior Health.
Oh, it's not ripe yet.
Stone's daughter, now 8 years old, wasn't even born when her mother's nightmare began. Like fellow nurse Leslie Warner, Stone has her own fraud file.
Yeah.
What's this?
This is everything that I've been dealing with for the past 10 years.
10 years.
Yeah.
So how did it all begin?
Someone had used Stone's name to take out credit cards at Canadian Tire, PC Financial, Future Shop, Best Buy, TD Bank, and others, and then started racking up the bills.
You can see this file is ridiculous. Just the amount of damage that they did in those first couple weeks took months and months to clear, and I've been dealing with it ever since. Yeah, it's the blue.
When Stone told her colleagues about being a victim of fraud, she discovered it wasn't just her, and that revealed a critical clue. It seemed their imposters had obtained all of their social insurance numbers.
My mom was very stringent, saying never give your social insurance number to anybody.
In 2014, did you believe that the source of the information breach was your employer, Interior Health?
100%.
Why were you so convinced?
Because I haven't given my information out to anybody else.
Nurse Tracy Maxfield worked on a different ward of the Kelowna General Hospital when a bank contacted her about credit card bills she knew nothing about. So she says she contacted IH about a possible data breach.
Vehemently denied it. Absolutely impossible. We have a state-of-the-art system.
But how would they know it wasn't a data breach from Interior Health if they hadn't even launched an investigation to conclude that?
Well, exactly, but it was dismissed immediately. Immediately.
So if executives at Interior Health were denying it, Maxfield decided to take matters into her own hands. She says she warned her colleagues directly about a possible data breach.
Tracy, why are you sending an email out to warn your colleagues about?
Because it wasn't dealt with. I was actually reprimanded for sending the email because it was not my business to do that.
Who reprimanded? You're reprimanded by someone?
By management.
Stone also warned the health authority about a possible breach and was met with a firm denial. There is no evidence to suggest IH is at fault. Had we had a large breach, it would be perceived that we would be seeing and hearing of thousands of employees' positions being impacted. This is not the case. So she fired back.
While IH may not be convinced that they are the root of this breach, I am. My tolerance level is reaching a breaking point. I just felt, using nowadays terms, very gaslit by the whole situation, and I just felt I was banging on the wall.
In fact, the Fifth Estate has learned multiple nurses and medical workers across the BC Interior began reporting their stolen identities to the health authority as far back as 2011. Pockets of victims in Kamloops, Vernon, Kelowna, Nelson, and Creston. At least 24 cities and towns. And yet IH remained firm in its position. If there was a data breach, it didn't come from them.
So this is crazy. This doesn't happen by accident. That's what I am dumbfounded by. How could they not believe these individuals?
We took the nurses' complaints to Anne Kavukian, who served as Ontario's Privacy Commissioner for 17 years.
What is the role of an institution like Interior Health at that point?
Their role is to step up and get their staff to examine all of those cases, to look under the hood, if you will. How did those cases arise? I can't believe they just denied it.
But those nurses finally found an ally here in Trail, BC. At the local RCMP detachment, a constable named Stuart Ward was new to the force, and one day a stolen identity case landed on his desk.
And one of the front counter staff had put a report on there saying so-and-so had come in. They had a credit card from a store in their name. They hadn't applied for it. They didn't know anything about it. And then she concluded it with, coincidentally, this is the third hospital employee in the last few months who's had this complaint. And I thought, that's not a coincidence.
So Ward widened his search, looking up all recent fraud complaints filed with the RCMP in BC's Interior in 2014. He called one of the victims. It was Ashley Stone.
So he called me in 2015. I was at work at the time, and he asked me who my employer was. And I said Interior Health, and the pause. And I kind of pressed him a little bit more and said, is this all connected through Interior Health? And again, keeping his cards very close to his chest, kind of said, you're not the only one.
At the end of it, I think I got up to either just shy of or just over 100 files, and every single one of them was an Interior Health employee, with the exception of one.
Okay.
But 99% of them Interior Health employees, invariably.
What did that suggest to you?
It suggested to me that Interior Health had a data breach.
So Ward says he contacted IH, expecting they'd do something, he wasn't sure what, to help the stolen identity victims.
That's beyond me. I'm just interested in trying to help those victims and see if I can't arrest the person who's used it.
And he didn't stop there. Ward says he also contacted the office of BC's Privacy Commissioner in Victoria after realizing this case was much bigger than one cop's small-town investigation.
I said, everyone on this list is an Interior Health employee. And that's as far as that went. I never got another call back from the BC Privacy Commissioner's office.
What did you expect the BC Privacy Commissioner's office would do?
In my mind, I thought, well, they're going to call Interior Health and say, why did you lose all this data? You are responsible for it.
So the Privacy Commissioner has the power and the mandate to be able to do that.
Absolutely. When I was Privacy Commissioner, I did that many times.
But the answer that they got from the Privacy Commissioner in BC was, there's nothing more we can do.
But that's absurd. You don't just ask. You go in and investigate. You go into Interior Health and you say, may I look at your records?
Soon after, Ward moved to an RCMP detachment in northern BC, and his investigation was closed. He's since left the force. But the case of the Interior Health employees has haunted him ever since.
It bothers me that nobody did anything initially when all of these people came forward and said, this problem I'm having. I think about this constantly, because they're going to have this for the rest of their life.
When we come back, victims are silenced as the denial machine kicks into high gear.
I was basically told that we can't, if you go public, we can't help you. We can't make sure that you still have a job after this.
Welcome to Royal Inland Hospital, where compassion...
For years, BC's Interior Health Authority has used PR campaigns like this to promote a reputation as a socially responsible government agency.
I'm here to announce that for the 9th time, we have been chosen as one of BC's top employers.
And when IH needed a nurse to be the public face of a community vaccination campaign, who did they turn to?
If you're a parent in BC's Interior and you've skipped some of your children's immunizations, don't skip this. As a public health nurse and a mom...
While Ashley Stone was shooting this public service video, she was still dealing with the fallout from her identity theft. So she says she turned to her union for support.
I wanted to go public, and I had heard previously of colleagues being reprimanded for saying anything negative about the employer publicly. I was basically told that we can't, if you go public, we can't help you. We can't make sure that you still have a job after this.
And which has helped sort of keep a lid on the size and the scope and the damage of this whole security breach.
Yeah, so many people are still nervous. I just ran into a friend the other day, and she's like, I need this job, and I'm so afraid that if I say anything, I won't have one.
It takes just a quick drive around Stone's Kelowna neighborhood to realize the impact this data breach has had on healthcare workers in BC.
My neighbor right down there, she found out just a week ago or so that she was the victim of identity theft. Definitely a few people who live up there have been victims of identity theft. I also have one friend who just lives up on this corner here. So it's not that we all live in the same neighborhood, it's just that there's so many of us.
Which raises the question, how did Interior Health keep the lid on this for so long? Back in 2017, the RCMP made a breakthrough in the case. The Mounties turned up documents in 2 unrelated arrests in BC's Lower Mainland with the personal information, including names and the social insurance numbers of 500 current and former IH employees. This would be a turning point for Interior Health. For years, the health authority had been admonishing its own employees for believing there'd been a data breach. And now it appeared IH had a major problem on its hands. But that's when the denial machine kicked into high gear. The health authority said an IT consultant's report concluded there was a breach, but it was limited to those 500 names and found no evidence of further breaches. IH insisted this was reassuring. No mention of all the other cases they'd known about for years. We asked the health authority for a copy of the consultant's report. Our request was denied.
What message does this send to the fraudsters themselves?
Keep at it. You're free and clear to continue doing what you're doing. See, that's what I find appalling, to come out with that kind of statement. I don't even know how anyone could make a statement like that, so self-assured.
3 years after Interior Health said it was reassuring there was no evidence of a widespread breach, an imposter took over the CRA account of Fernie nurse Leslie Warner. Her fraudster went to an H&R Block office in Alberta to cash in a fake tax return. And then...
They had made 3 children's birth certificates under my name, me being the mother, and they were claiming Alberta Social Services.
Tax benefits or
child benefits. Yeah, child benefits with my identity.
And even then, her problems weren't over yet. Far from it.
I got a call that the RCMP had some papers to serve me. I met the RCMP at my house here, and I said, "Oh, have I been called for jury duty?" And he said, "No, actually, these are criminal charges."
She was taken to the local RCMP detachment where the Mounties snapped her mugshot, took her fingerprints, and explained she was being charged for crimes in Alberta.
I wouldn't wish it on anyone. It's a complete nightmare.
And who's your advocate? Who's standing up and fighting for you?
No one. There's nobody.
And our investigation has revealed Warner was just one of many Interior Health victims who had their CRA accounts hacked through H&R Block locations in Alberta. Criminal networks in cities and towns across Alberta were also taking out fraudulent credit cards and car loans, from Edmonton to Whitecourt, Red Deer to Lethbridge. But how did they get a hold of so many names from British Columbia? And that's when our source we're calling anonymous dropped a bombshell. He sent us a spreadsheet with the stolen personal information of 28,000 people living in BC's interior. Names, social insurance numbers, birth dates, phone numbers. 28,000 people. That's enough to fill this Kelowna hockey rink 4 times over. And Anonymous pointed the finger straight at Interior Health.
The list I provided was compiled from Interior Health in British Columbia, and it was obtained through a data leak years ago. This information has been sold and distributed to thousands of people over the past 5 to 6 years.
As we scoured the list, we found some familiar names. Leslie Warner, Ashley Stone, and Tracy Maxfield. In fact, every person we contacted on that list was a current or former employee of BC's Interior Health Authority. So we returned to Creston and Jimmy's Pub. Heidi Gurman told us last year she wanted to know how her identity was stolen. Now we had an answer.
So after our story aired, somebody got in touch with us who said, I know how Heidi Gurman's identity was stolen.
Like my name?
Yes.
What?
He singled you out specifically.
Yeah. Huh. Okay, that's creepy.
And sent us a screenshot of a list that he had bought on the dark web.
We showed her the list we were leaked by Anonymous, and it hit close to home for Gurman, who'd worked as a drug and alcohol counselor for Interior Health back in 2008.
Yeah, there you are on the, you're not the only Gurman.
No, Natalie is my sister, Esther's my sister, Judy and Kelvin are my parents.
So why would all of their
We all worked for Interior Health.
You all worked
We all worked for Interior Health. Yeah.
And you're all on this list.
Yeah.
Bingo.
For 5 tumultuous years, Leslie Warner also had no idea how her identity was stolen until we told her.
So that was crazy news to hear. So that is frustrating. And it's frustrating that as each month passes, there's probably more victims that it's actively happening to. And I just don't know when it'll stop.
When we come back, we go on the hunt for the imposters.
My name is Mark Kelley. I'm at CBC Television, Fifth Estate.
Good morning, I'm Chris Walker in Kelowna. This is Daybreak on CBC Radio 1.
If you were in BC's interior this spring, it was hard to miss an emerging scandal that some say had been buried for a decade.
New developments this morning in that Interior Health data breach that we told you about back in April. The personal information of thousands of Interior Health employees stolen and then sold via the dark web to identity thieves. Fifth Estate's Mark Kelley is on the line from Creston this morning, where he's been speaking with some victims of stolen identity. Good morning, Mark.
Chris, good morning. We're talking about social insurance number, phone numbers, address, the information that can be used for identity theft. So that's one concern that's been raised by some of the employees there. And their concerns go back, Chris, more than a decade.
And Mark, you'll be in Kelowna later today, hoping to talk with more Interior Health employees. Safe travels.
Thanks so much, Chris.
Now, in the meantime, if you've been affected by that data breach at Interior Health, Mark and the rest of the team at the Fifth Estate would like to hear from you.
My name is Andrea Harris.
My name's David Lucas.
My name is Chandra Hauer.
My name is Sheldon Ambler.
My name is Laura Buston.
My name is Kathleen Reimer.
My name is Randy Johnson.
You're all going through this. What do you want them to know?
And show up they did. An informal town hall. Hospital employee after hospital employee.
I realized my identity was stolen in early 2023.
I was a victim of fraud in 2022.
It was 2 years ago, the first time my identity was stolen, and once again last week.
I had my identity stolen in 2021.
It was October of 2022 that I realized my identity had been stolen.
Randy Johnson said his identity was used at least 10 times to take out credit cards and buy jet skis.
At one point, I was underwater about $170,000. We had a bailiff at our house telling my wife and I at the front door early on a Sunday morning that they were going to take our house, that I had the wave runners, he knew I had the wave runners, and my debt was never going to go away, and they were going to take all our assets.
I had a whole list of credit cards all taken out, over $20,000, all in my name. So, yeah, it was, and I was a newly single parent, so it was really tough because you're navigating being a single mom with 2 kids, and then this. So it was really tough.
Someone took its toll on you?
Mm-hmm.
When I filed the police report, the police said, well, do you work for Interior Health? I said, yeah. It was awful. Like, you know, I worked my buns off to get to where I am. I have excellent credit, and someone just came and stole that all away from me. You know, 20 years of hard work, basically.
The biggest one is the CRA fraud, where they had completely accessed my CRA account through an H&R Block in Calgary.
How much was it? Do you remember?
It's in the 30s, $30,000. They say I owe them in owed taxes.
Did Interior Health tell you that your identity had been stolen?
They never told me, no. It's scary. Like, it's a very scary feeling to know that there could be debt out there in my name that I'm going to have to fight to prove that it's not me.
And do you feel anyone's helping you in your fight?
Nobody's helping me, no.
You trust your employer. Like, we work in a health authority, so patient confidentiality is absolute most important. You expect your employer to do the same with your information.
With statements within 2 minutes.
And the anger spread from the BC Interior to the BC capital.
The Fifth Estate found that the stolen identities taken from Interior Health employees have been used for fraudulent CRA refunds and loans.
The BC Conservatives demanded answers about a health authority plagued with problems.
What kind of gong show is this government running in Interior Health? You can't get a doctor or count on an ER room, but if you're a nurse, you can now count on your information being stolen.
This government takes the privacy of information incredibly seriously, as do the health authorities.
So who are these imposters? We got back in touch with Anonymous, the self-proclaimed ex-criminal who leaked us the list. According to Anonymous, the list was likely stolen in 2009 and later posted for sale on the dark web.
I first obtained it in 2017. This information has been sold and distributed to thousands of people.
$15 a name or $1,000 for the whole list. Anonymous said there are tutorials on the dark web for how to use the stolen names, but by invitation only.
It's a closed loop of criminals, and the only way to get in is to be vouched for by another member.
We wanted to find the members of this criminal operation. We searched the fraud files of 3 victims, Heidi Gurman, Leslie Warner, and a former IH employee from Salmon Arm who wanted to keep her identity confidential. In her file, we discovered an address in rural Alberta used to apply for credit cards in her name. So we headed to the small community of Sylvan Lake. Our online digging led us to this Facebook post belonging to someone named Nicole Ray Armstrong. She was charged with possessing identity documents belonging to 3 Interior Health employees. The charges were withdrawn for procedural reasons. Armstrong now faces 21 new criminal charges, 18 of them fraud-related. We wanted to talk to her.
There's nobody here. Or if there's somebody, it would be an aid.
But it seemed she didn't want to talk to us. So we followed up with a phone call.
Hello?
Hi there. Can I speak to Nicole, please?
Yeah. Hello?
Hi there. Is this Nicole?
Why do people always hang up on me?
We then went looking for Leslie Warner's imposter, the Fernie nurse who was charged with crimes committed in her name. This little bungalow in Edmonton played a key role in Leslie Warner's identity theft. The Canada Revenue Agency had this listed as her address. She was also named as the director of a bogus company that was supposedly headquartered here. We don't know her imposter's real name, but this is the fake ID police told Warner they used to get fraudulent child tax benefits. But when we showed up, the house was empty.
Sounds empty.
Leslie Warner's imposter long gone. We then went to track down Heidi Gurman's imposter, the bartender from Creston, BC. We obtained a credit card statement used by the imposters to scam this restaurant. We obtained CCTV footage, and there she was. We've identified the woman as Christina Churpak. She has a lengthy criminal record, including charges of identity theft. Then we got a break. Turns out she had a court date in Edmonton, so we went to the courthouse to find her.
Hey, Christina. My name's Mark Kelley with CBC Television, Fifth Estate.
Churpak's appearance had changed since we revealed her identity in our last documentary.
Just want to ask you questions about the identity theft. I just want to find out how you got those names that you could use with the stolen identity. Christina, what will you say to the victims who've had their lives turned upside down? Christina, you can't just walk away from this.
Churpak never uttered a word in her own defense.
Hi.
Nice to see you again.
Yeah, you too.
Back in Creston, we showed Heidi Gurman the footage of our encounter with Christina Churpak.
Shortly after this, she
Yeah.
gets in a cab and drives away.
Yeah.
And essentially, she's free, walking free.
Yeah.
You're still trying to rebuild
Yeah.
your name.
Yeah.
What would you want someone like Christina to know about the consequences of her actions?
I think the biggest thing is there's real people behind these names and these numbers and these identities, right?
Do you think that Interior Health has taken this seriously?
Well, I've never heard from them, so I don't even think they know. So no, I don't.
BC's Interior Health Authority continues to take no responsibility for the security breach, refuses to apologize to its frontline workers, and denied our request for an on-camera interview, saying the matter is being investigated by the RCMP. When we come back, we take the fraud victims' concerns straight to BC's Health Minister.
Mark Kelley from the CBC program, The Fifth Estate. Yeah.
It was the spring of 2024, and for 10 long years, BC's Interior Health Authority had been denying it was responsible for a massive data breach. And then another RCMP revelation would make that claim even more difficult. The Mounties found a list with a staggering 20,000 stolen identities, including the names of 7,000 current IH employees. IH's VP of Digital Health spoke to Global News.
We're actually unsure of how this information came into possession of the individual when the RCMP discovered the file. But it is concerning. It's sensitive information.
For the victims, this just confirmed what they already knew. But in that Global News interview, Interior Health treated the news like a lightning bolt out of the blue.
Want to reach out to employees, both active and inactive, and make sure they're aware of this discovery and have the opportunity to protect their identity through credit monitoring.
Then the denial machine kicked into gear once again. Unlike in 2017, the IH press release didn't call this a breach. Instead, it was referred to as an information incident. In a message to employees, IH said external security experts concluded this information is not circulating on the dark web, a forum where criminals buy and sell stolen information. Again, we asked IH for the report. Again, IH refused our request. The former criminal Anonymous dismissed any suggestion the list was not for sale through the dark web.
That is untrue, as me personally, as well as others, have bought it on Telegram shops and other dark web forums. I'm sure they released that statement as a protection from liability and act like it's not that big of a leak.
Why do you think there's been this failure to take responsibility? Do you believe that they honestly believe the leak did not come from them?
I think it'd be hard to deny it at this point, but I think it just opens them up to, it opens a Pandora's box of liability and accountability that it's easier to sweep under the rug, and hopefully it will go away.
But it's not going away. Just ask these people.
I tried to sign a loan for my son going to university, like a $6,000 line of credit, and they wouldn't approve it, and I didn't know why, and now I know why. There must be something going on. Yeah. So I'm really scared that there's stuff out there in my name, and I still don't know about it.
Because I think they should pay for what they've done. Like, it was brutal. It was like I almost got turned down for buying a house because my credit was so bad.
So Interior Health offered its employees 2 years of credit monitoring, calling it a precautionary measure, as if their identity theft had never even happened.
I said to them, that is useless to me. I'm already a victim. So it had been over almost a year, and there's no one to help.
Shame on IHA. That's all I have to say. I worked for them for a long time, and if that's, I mean, once they have your SIN number, the criminals, you're done.
Which brings us back to the former RCMP constable who set off alarm bells with his investigation a decade ago, Stuart Ward.
I think that any of these companies that are losing personal data should be on the hook for ensuring that these people are safe, unfortunately, for the rest of their lives. Throwing out these 2-year credit check reports isn't helping anyone, because 2 years from now, you still have the same personal information. So somebody has to help them.
And yet so many of them tell us that they were the ones who were made to feel like they did something wrong. And they didn't do anything wrong.
They didn't do anything wrong. There was nothing that a single one of those victims could have done to prevent any of this happening. This is not their fault.
You know, the first thing I should probably say is that I really feel for the victims of this breach and this identity theft and what's happened to those folks.
So we headed to Victoria to meet BC's Information and Privacy Commissioner Michael Harvey. Appointed just last year, he echoed what many victims believe, but Interior Health continues to deny.
Is the source of that leak, was it Interior Health?
That's my understanding, is that this information came from Interior Health. That's my understanding. We have not conducted an investigation that concludes that, but that is my understanding.
Still, Commissioner Harvey says he won't investigate Interior Health's handling of the breach.
Their obligation is to take reasonable safeguards. And so I need to have evidence.
We have a list of 28,000 names with their social insurance numbers, their personal information. What more evidence do you need at that point?
I would need to have evidence to show that that information was gotten onto the dark web through them failing to meet their legal obligations.
But you understand how unsatisfying that is going to be for the people whose names are on this list.
It is not within my authority to do anything that could assist these people.
Who can then?
Well, I think that law enforcement can and the courts can.
And the Privacy Commissioner, where are they? They should be all over this.
Former Ontario Privacy Commissioner Anne Cavoukian says it's time the BC government took responsibility, since Interior Health hasn't.
See, this is why you have to go to the Minister of Health and the Premier, because you can't engage these individuals. They're not speaking to you responsibly. They're not telling you the truth. They're covering things up, obviously. And you need someone to say to them, open up. You have to be truthful about this. We have to discontinue this activity of covering up.
I am really honored to serve as BC's Minister of Health, and it's been about 10
We sent multiple requests to BC's Health Minister Josie Osborne for an interview. Her office eventually declined, also citing an RCMP investigation. So we showed up to an industry-sponsored event to bring the victim's concerns directly to her. We waited as she posed for selfies. We were the only journalists in attendance.
I understand your time constraints. I respect
Yeah, yeah. Thank you.
We told her chief of staff why we were here. Watch as she warns the minister we had questions about Interior Health.
I don't know if we have time. Okay.
Very quickly, Minister Osborne.
12:05.
Mark Kelley from
Hi.
the CBC program, The Fifth Estate. Yeah,
Hello.
we've just come here from Toronto
Yeah.
just for a couple of questions
Yeah.
for you. We've spent months now investigating the data breach at Interior Health. Will you and your government now acknowledge that Interior Health is responsible for that data breach?
Thank you very much. I'd love to follow up with a conversation. We are going to go catch our plane right now.
The data breach occurred in 2009.
Thank you, though.
It's 2025.
Oops, sorry. Thank you.
The nurses have been waiting for some answers,
Thank you.
some truth and transparency on this.
We do have to run.
Will you apologize for the inconvenience that this has caused?
Thank you for the questions.
follow up,
and we'll
for
be
sure.
happy to follow up.
We have been asking you for
Sorry, Mark,
weeks,
we will. We'll
for
follow up,
weeks,
for sure. Yeah.
and now we're here.
Yeah. We'll follow up.
You're walking away from your own employees. Unbelievable.
We never did hear back.
Transparency on this?
Back in Kelowna, we showed our exchange with the health minister to Ashley Stone.
It's kind of been the theme throughout this whole experience anyway. So I guess it's unfortunate, but I'm not surprised. There's no resolution. There's no like, here's the way and it's going to get fixed for you. It's just like, this is an unfortunate road to go down and nobody cares.
After 16 years as a registered nurse and a decade fighting Interior Health to get some accountability, Stone has decided to leave nursing, but she won't give up the fight.
Oh, I honestly just want to put all of this behind me and forget it ever happened. And I just want to continue to be an advocate for my colleagues who are still working full-time and need that work full-time and feel too afraid to speak up, because I'm not afraid to speak up anymore. It's never over. It's never over. They have your personal information. It's never going to end. They can use it at any time. It's public information now. And I could be 80 years old and still be dealing with this.